Historically, the state has spent tens of millions of dollars annually from the general fund to provide mental health treatment services to parolees, as well as to assist certain inmates with applications for benefits such as Medi-Cal prior to the release from prison. Our analysis indicates that there are potentially federal funds available to offset some of these general fund costs under current law. In addition, if the state expands the Medi-Cal program in 2014 as authorized by the Affordable Care Act, the amount of potential general fund savings could grow considerably. Medicaid is an optional joint federal-state program which provides health care coverage to certain low-income individuals. In California, the Medicaid program is known as Medi-Cal and is administered by the Department of Health Care Services. Generally, the costs of the Medi-Cal program are split evenly between the state and federal government. The services that are provided include a variety of medical services as well as mental health treatment services. Typically, in order to be eligible for Medi-Cal, an individual must be low income and they must fall into certain categories such as being blind, pregnant, disabled, or having dependent children who are eligible for Medi-Cal. The recently passed Federal Affordable Care Act allows states to expand their Medicaid programs with the federal government paying a large percentage of the additional cost for the program. Specifically, beginning in January of 2014, the federal government gives the states the option to expand their Medicaid programs to cover most low-income individuals under 65, including childless adults, with the federal government picking up 100% of the share costs for their services. Aside from Medi-Cal, the California Department of Corrections and Rehabilitation also delivers some mental health treatment services specifically for parolees who are under state parole supervision. These services are delivered through two programs. The first program is a series of parole outpatient clinics located throughout the state. These POCs employ a variety of clinicians, including psychologists, psychiatrists, and social workers, to provide treatment to mentally ill parolees. These services include case management, as well as prescribing and monitoring the use of psychiatric medications, and providing some other crisis management services on an as-needed basis. The second program is known as the Integrated Services for Mentally Ill Parolees, or more commonly by its acronym, the ISMIP program. ISMIP provides services to mentally ill parolees through contracts with counties and private providers who provide more comprehensive mental health services such as case management and counseling services to severely mentally ill parolees who are at risk for homelessness. In addition, the department assists certain individuals with disabilities, including those with severe mental illnesses, with applying for benefits programs such as Medi-Cal prior to the release from prison. In total, the California Department of Corrections and Rehabilitation will spend about $58 million for the programs I've described in the 2013-14 budget year. While these programs have historically been funded primarily through the general fund, our analysis indicates that federal reimbursements are potentially available for some of these services, including assisting inmates with Medi-Cal applications prior to the release from prison, as well as some of the mental health treatment services provided to parolees through the POC and ISMIP programs. However, at this time, it appears that the CDCR is not obtaining all of the federal funds that are potentially available. Right now, the CDCR is obtaining a small amount, about half of the funding we believe is potentially available for psychiatric medications for parolees. They're also obtaining a small portion of the funding that we think is available for the ISMIP program. But CDCR at this time does not obtain any reimbursements for POC services, nor do they obtain any reimbursements for the cost of assisting inmates with Medi-Cal applications. There are several factors that we've identified that are preventing CDCR from obtaining the available federal reimbursements. For example, CDCR does not ensure that all Medi-Cal eligible parolees are actually enrolled in the program. In addition, CDCR does not track the number of staffing hours that are devoted to delivering Medi-Cal covered services to Medi-Cal enrolled parolees, nor have they developed a process for actually drawing down the federal reimbursements that might be available for those services. Finally, most of CDCR's clinicians lack the Medi-Cal certification that is required to draw down federal reimbursements. Now, conversely, according to CDCR, ISMIP providers are required to be Medi-Cal certified, and they should be able to draw down federal funding under current law. However, according to CDCR, only one provider, Santa Clara County, is actually drawing down federal reimbursements today. The state also lacks a process for tracking the costs of providing Medi-Cal application assistance to inmates prior to their release from prison. In total, we estimate that about $6 million in federal reimbursements are available under current law for these mental health treatment services. This is a fairly small amount because currently most parolees do not qualify for Medi-Cal because they do fall into the category of low-income childless adults who are not currently eligible for the Medi-Cal program. However, if the state were to expand the Medi-Cal program consistent with its authority under the Affordable Care Act in 2014, we estimate that most parolees will become eligible for Medi-Cal, and this could increase the amount of potential federal reimbursements into the tens of millions of dollars annually. However, at this time, it appears that the state does not have a plan to draw down these additional available federal funds. In order to maximize the federal reimbursements that will be available, especially if the state expands the Medi-Cal program, we recommend that CDCR take the following steps. First, we recommend that CDCR ensure that all parolees who are going to receive mental health treatment are enrolled into the Medi-Cal program. This would include providing assistance to inmates prior to when they leave prison, as well as to current parolees who are receiving mental health services in the community. Our second recommendation is that CDCR work in collaboration with the Department of Health Care Services to develop a process to claim federal reimbursements for the cost of assisting inmates with Medi-Cal applications. Third, we recommend that CDCR, again in collaboration with the Department of Health Care Services, develop a process by which the state can submit reimbursements for mental health services that are provided at parole outpatient clinics and through ISMIP providers to mentally ill parolees. If the state were to take these steps, we estimate that savings of about $6 million in 2013-14 could be achievable, and that amount could grow to about $28 million in 2014-15 and ongoing. For more information on this subject, please refer to our recently released report entitled Maximizing Federal Reimbursements for Parolee Mental Health Care.